I haven't talked to you since last spring and maybe early summer when the pandemic was really just starting. And now we're, of course, in this other surge. Can you tell us, kind of give us the lowdown on what you see from a global perspective?
So Katie, it's nice to see you. I've seen some of your lives, where it's really nice that you do this. I think it's great. So many of the health workers that you've interviewed, I've really been touched by a lot of those stories. So I just wanted to let you know that, and I keep doing that because I think more people need to hear from health workers.
Thank you.
But the global picture is really mixed. We have countries right now, at the end of the year, almost a full year into this pandemic, we have countries on the one hand that have brought the virus under control. Their societies are opened up. They have stadiums full of people. The cafes are open. They're living their lives. That they will be having, a holiday season that looked similar to last year with some precautions. We have other countries that have gone through, really terrible outbreaks. They brought transmission under control. They're starting to see a little bit of resurgence, and they're remaining at the ready. I mean, even countries that brought it under control are just at the ready.
Right.
Any cases that come up, you quickly act and you prevent a seeding again to really take off. These embers, you don't want these embers to turn into fire. We have countries that are going through these peaks and troughs. Europe, where I live, a lot of it is like that right now, where they had a big peak in the spring. And the peak in the spring was probably larger than what was detected because testing wasn't up and running as high as it is now. Huge peak in the last few months. And now with the restricted measures in place, we're starting to see a decline. But with the holidays coming up, we're really worried about the activities that people will do, which we completely understand of wanting to be together, which will fuel another outbreak, another peak.
So tell us, Maria, before we talk about sort of advice for the holidays, tell us what countries are doing well, what countries are not doing well. And someone just asked if a new COVID strain was found in the UK, if you know anything about that.
Yeah, so there's so many countries that are doing well. I am keeping a list, and I keep in my notebook, I have these notebooks that I keep, which is going to be my history of this pandemic, because I can't believe we're in December right now. There's so many countries that have done well in terms of showing us that this comprehensive approach of active case finding, empowering communities, isolation of cases, clinical care, quarantine of contacts, cluster investigation, everything. We've got China and Korea and Hong Kong and Taiwan and Japan and Vietnam and Thailand, New Zealand, Australia, Senegal, Cambodia, Germany, Rwanda, South Africa, Qatar, UAE, Saudi Arabia, Madagascar, Finland, Norway, Uruguay. I could go on and on. And the reason I'm listing so many locations is because they've shown us that by, working really hard, applying the interventions, applying the measures, these are public health measures. There's no sophistication here. It's really hard to do, but there's nothing in this that all countries can't do right now. And they can control COVID. When you ask me about sort of the global picture, the third category of countries are countries that are just in intense transmission. And the United States is in this position where you've had surge after surge after surge. But, having said that, this virus and the characteristics of this virus, what we learned about it in the beginning, the studies are confirming, the way that it behaves, the way that it moves, how the disease that it causes, it's still controllable. The virus that you mentioned, the mutation from the UK. So we have an international lab working group, which was established, in the first days of this pandemic, because that's just what we do. We convene these networks, and we've been looking at mutations from the beginning. And we formalized this working group in June to make sure, because we knew that the longer this virus circulates, the more opportunities it can change. But mutations are normal. These changes are normal. And they change, coronaviruses change at the slow end of the spectrum in terms of mutation rate compared to some other viruses. So that's good. But there are mutations that are being detected. The first one that, that you've probably heard about maybe is this D614G. And this is a mutation that makes the virus more fit. And that's what viruses do. They outcompete each other. that was first detected in January and February, and it's replaced the circulating virus in June. But this one that was identified in the UK, we don't know much about. We're working with UK authorities. They found it has several mutations, and one of the locations is called this 501Y. It's in the spike protein. It's in the location of the spike protein. And what we're working with the scientists from the UK on is to understand what it means, because all of these mutations need to be assessed properly. And we need to understand if it causes more severe disease. There's no indication that it causes more severe disease. We need to understand if people who are infected with this variant, this virus variant, still develop neutralizing antibodies. We need to determine if people with this virus can still be detected with the currently available diagnostic tests, can be treated with the available therapeutics, and this vaccine will still work against this variant. There's no indication that there are changes associated with any of that yet. But what we need to make sure that we do is we do these studies, and so that we can do a proper assessment of what it means.
Well, these mutated viruses, does it mean, will the vaccine be effective against the mutation of the COVID-19 virus, or are they going to have to start at square one?
No, we're not going to have to start at square one. And so what I said is there's no indication that this has an impact on the vaccine. But what we want to do is outline that there's a robust process to evaluate that. You will hear all of these claims over and over again that there's a mutation, there's a mutation. We've seen this movie, everyone has seen the movie where it mutates and it's changed. But there needs to be a proper scientific assessment of it. And when you detect a mutation, the way that we detect these mutations is because countries all over the world are doing full genome sequencing of the viruses that they find. And there's more than 300,000 sequences that are available, but we need more. And we need more from countries, and that helps us to evaluate this. So the vaccines, the news of the vaccines is incredibly hopeful and incredibly promising. So I don't want people to worry. Let the assessments be done. And if something needs to be changed, it will. But right now, the vaccines that are being approved and starting vaccinations is really hopeful. But I do think, Katie, and I don't know how your viewers feel, I don't know how you feel, but I do think that the next few months, the next 6 months are going to be really frustrating for people, because they're going to want the vaccine and it's going to take some time to get it to them. And globally, this is a massive challenge for us and for the world. And we still need to hang on tight and do all the hard work of the physical distancing and the avoiding crowded spaces and wearing of masks while the vaccination rolls out.
I think you're right. I think that it's frustrating, especially for people who have lost their livelihoods, right? Their businesses have closed and they can't support their families. And of course, they're hopefully coming up with a COVID relief package on Capitol Hill finally. But even that is not going to be enough for many folks. So I think, I feel their pain and understand it. I think that we just do have to stay vigilant and wait our turn and let the high risk people go first. And we have to, it's the right thing to do, and we have to do the right thing. So I think that most people understand that, I hope, even though they're starting to go a little bit crazy. But I think that's such an important point, though, because I think the vaccine horizon is going to give people a false sense of security. And the fact that there are better therapeutics than there were initially may make people less vigilant about all the things they need to do: mask wearing, social distancing, washing of hands, et cetera, et cetera. So I don't think we can emphasize that enough. You mentioned Germany, and I thought, it's really hard to keep up with everything that's happening wise globally. But Germany has had some blip. Spain, Italy. How are they managing when the spikes, like a second surge, has occurred? Are they taking quick, decisive action? And are they able to mitigate some of that?
They are. I mean, what countries are doing, I think in the beginning, most countries put in these national lockdowns, so-called lockdowns. We don't use that word lockdown because it means so many different things to so many different people. And it's a combination of interventions. What we're seeing now is that countries are using the data that's coming from their surveillance systems, their testing systems, to drive the response. They know where the virus is. If you know where the virus is and where it's circulating, you can take the right actions to target limited resources, tired individuals, limited capacity to where it's needed most. And that's what we're seeing countries are doing. So in Spain and in Italy and in Germany, in Japan, for example, I was speaking to someone from Japan today, and they know exactly where the virus is and where it's spreading. And when you know that, you know how to fight fire. So without that, it's incredibly difficult to strategize what you need to do and where, and you need to throw everything you can at it. But I do think that it's all of the decisions that each of us take, but we need to be able to do that. You mentioned people losing their livelihoods. If we tell them to stay home and close their businesses, I'm not an economist, but we need to be able to support them to do that, so that they can carry out those actions. We have people all over the world who make day wages, and if they can't make their day wage to feed themselves and their families, that is a tragic situation. So how do we help and support individuals that need to be physically distant, yet be able to perform some of the duties for their job? And it's complicated, but we are seeing countries work through those solutions in a stepwise approach.
You keep track of countries in the world, and I know you're American, but how do you feel about the job the U.S. has done versus many other countries if you had to really evaluate it objectively?
Yeah, I mean, it's frustrating to see, because we work with so many amazing, scientists and public health professionals all over the U.S. and who work in our working groups and who are part of our teams. And, we're really, what I see in the U.S. is I see tremendous capacity and resilience. And what I see and what I know is that you will turn this around. I know it. I mean, I know it. You know it too. And I think what people need to understand is that you need a strong, national plan that's implemented at the most local level. Everyone needs to know what their part is. Every day, what are you doing to contribute to this? And so many people are making sacrifices to fight this. We just need to hold on a little bit longer to get through this. And I think it won't end as quickly as we want. I don't have an end date. Don't ask me the end date. But the end date is in our hands. The end date is.
But a lot of people, as you know, in this country are not complying with mask wearing. They're not there. Young people are gathering in social activities, families together, and small gatherings are really apparently largely responsible for much of the spread. So, how difficult is it going to be to get it under control in the United States if there's this strain of non-compliance that really people aren't listening to the experts?
Yeah, it's going to be difficult. I mean, I think trying to understand why people aren't compliant is really important. We see this in many parts of the world where there are groups that are not complying to the measures that are put in place. But the real question is why, and what needs to be addressed to actually reach these different groups to understand what it is that is prohibiting them from taking those actions. I've never been involved in something that's been more politicized in a way, and this is just not for the US, it's everywhere. But I think we have to find ways to connect, and we have to find ways to make sure that people understand they know why they're doing what they're being asked to do. And we need clear, consistent, open, honest, humble communication. We know a lot about this virus, but we don't know everything.
Right.
We know enough to take these measures, to put in place, because we've seen the virus be brought under control with these measures that we have. And these aren't fancy tools, but I think we need to really find ways to engage communities and understand why.
Definitely. And, we have a long road to go, or a long road to hoe, as they say. But I want to ask you some questions from social, but
Right.
I also want to ask you a question from my assistant, Lauren Osborne, because I love her, and lives in Chicago. She said her brother and his family had COVID weeks ago. They have their girls in daycare and believe they got it from there. The girls were asymptomatic, but her brother and his wife had traditional symptoms. They have the antibodies. They're most likely protected from getting it again, although there are rare cases where people have been a second time.
Yeah.
They're protected for a few months. I guess Lauren wants to know, can they still pass the virus on to others if they're exposed?
That is a fantastic question. And that's one of the questions that we're looking at for the vaccine as well, the same thing. If the vaccines prevent against the development of disease, or if they prevent, and in addition to that, prevent against onward transmission.
Right.
We don't have a complete picture. So we are asking people who have been infected to still comply with the measures that are in place. So still wear the mask, still practice hand hygiene, still practice your physical distancing. I mean, I think within the bubble of the family, I didn't get all of the people that you mentioned in your question.
Yeah, this is a second family. This is my friend Lauren's brother's family.
Okay.
So I don't think they have necessarily been interacting with them. I think she's been extremely cautious, but I guess Lauren must be asking to see her brother and his family if they've been infected and they have the antibodies, or is there a chance that they could then get even if they have the antibodies, they could somehow be carrying the virus still?
They could be, but the thing that we're worried about is we don't know how long the antibody response lasts. So individuals who've been infected, they're 90 to 100% of people who've been infected will develop an immune response within a few weeks. So we know this. We know that individuals, even with mild infection all the way through severe infection, will develop an immune response. What we don't know is how long that lasts, and we don't know if there's different levels of protection based on the type of disease you had. So if you were asymptomatic, do you have less protection for somebody that was severe? We don't know the answer to that. And we don't know, we're getting clues, and we're in a much better position than we were when I spoke to you last, that the antibody response can last 6 months, maybe even longer. And that's good news. But there may be situations where antibodies go down or reduce after 3 months. So we don't know. And so until we know, we need everyone to still comply with these measures in place. And as the vaccines are rolled out, those types of questions will be evaluated amongst the people who are vaccinated, so we can have better answers to that question.
Well, having said that, somebody asked, once vaccinated, can you still pass on the virus to others?
So that question, we don't know the answer yet. That's what we need to better evaluate. The studies that are underway, the phase 3 studies and the approvals are focusing on protection and antibody response and preventing the development of disease and development of severe disease. That's the endpoint that is being evaluated. What we also need to understand is the question that you just asked. In addition to that, it'll prevent you from infection, but can you carry the virus, for example, and pass it to someone else? So these are questions that we don't have answers to yet.
Hopefully not. Someone asked, how will different demographics know it's their turn to get the vaccine? But I know you believe young people really need to be vaccinated because in many cases they're carrying it and infecting older relatives.
Well, ideally, we want everyone vaccinated. But the rollout we need to prioritize who receives the vaccine first. And it depends on the strategy. I mean, the strategy initially is looking at reducing morbidity and mortality, protecting those who are most at risk for developing severe disease and dying. So these are older age groups. These are people with underlying conditions, and also protecting frontline workers, people who are most exposed. But eventually, now we need to do that ideally in every country. So focusing on the high-risk individuals in every country, as opposed to vaccinating everyone in a couple of countries. That's our goal as WHO with our partners through our COVAX facility. So by the time there's more vaccine production, and I think, Katie, one of the other things that makes me really, really hopeful is that we're not just talking about one vaccine. We're talking about multiple vaccines. And there are many that are still under evaluation. So I'm hopeful that we will have even more that are produced all over the world, that don't need cold chain at minus 80 degrees, that can be distributed all over there's a lot of hope that's there, but it will take time to reach people who don't have underlying conditions, people who are younger. But we need to play our part. We need to wait our turn, and we need to do everything we can in the meantime to, prevent it from spreading.
How many vaccines potentially do you think will be developed? I know that 4 are being developed under Operation Warp Speed in the US. What about globally?
Oh, I don't have that number, but there are many. There are, I think, at various stages of development through phase 1, 2, 3, and 4, hundreds. There are hundreds that are in development. So I don't have an exact answer to that, but there are many.
Are you worried about, I read a piece this morning about how the media is reporting on these sporadic side effects. And, this is at a time when there's a lot of mistrust, especially among people of color in the whole vaccination process, given the dark history with the Tuskegee study for syphilis. So, you've been monitoring the administration, very early administration of these vaccines. Yeah. Do the side effects or adverse reactions surprise you or harm you?
Well, this is what we need to follow. And we really need to understand who is having these side effects and what those side effects are. I mean, the phase 2, the phase 3 trials phase 3 is looking at safety and efficacy, and they follow adverse side effects. But as we roll this out, we need to carefully monitor this over time. We are going to see side effects. Most vaccination programs aren't aimed at vaccinating 7 billion people. And so we really need to be carefully monitoring them and evaluating what each one is. Is it related to the vaccine? Is it related to something else? Any side effect is worrying because we just need to make sure that we monitor it and understand it. But yeah, and there are different vaccines that are out there. So we will need to evaluate this with each of the different vaccines, which some of the vaccines could be catered toward different populations, different types of allergies or whatnot, in different age groups. Yeah.
A lot of questions from people wondering, are we going to have to take this every year like we do flu shots? Or is this, do we know how long this vaccine, are we going to need a booster, for example? I know each vaccine is 2 shots, at least the ones that have been approved. But are you going to have to get them annually, or you have to get a booster at some point in time? And is that something you just don't know the answer to?
I just don't know the answer to that yet. But what is interesting about this virus is that if we can bring transmission under control, there's no reason why we have to see a resurgence. So there is the possibility that with the introduction of the vaccine and vaccination, that we could bring transmission down so low that what we see the next time around is a cluster. And that's it. We don't see it spread like you're not in the same situation in the US that you're in right now. And I think that's kind of what we would see going forward, as opposed to like the flu season every year where it's a new strain. The reason you need a vaccine every year is because it's a different virus every year. And so the vaccine is preventing against that the virus that spreads, slightly changes. It's different than coronavirus is. But in this situation, what we could see is that with the tools we have in place now, plus vaccination, we could bring transmission so low that what we would need going forward may be something more like ring vaccination, like where if you have a cluster or a flare-up, you may need to boost people or vaccinate people. Yeah.
Well, there's still so many unknowns. When you think about 2021, Maria, and by the way, I'm talking to Maria Van Kerkhove, who is an epidemiologist with the World Health Organization, who just froze momentarily at a good time. Reintroduce her. But when you think about 2021, before we go, Maria, there you are. You froze for a second.
I'm here. Can you hear me?
Okay. Yes, you're frozen. You froze at a good time because I was reintroducing you to people who are watching. Before we go, you say this is a huge undertaking. Are you worried about the distribution of this vaccine and logistical challenges of getting it to the people who need it? And secondly, when do you see things kind of everybody being able to take exhale, to take a deep breath, and then have things kind of come back to normal? For example, will my daughter be able to get married in July, Maria?
No pressure on that question at all, I'm sure.
Get married
I mean,
in
for the
July.
vaccine, she's getting married in July. You've got some time. You've got some time. I think with the vaccine, I mean, rolling out a vaccine at a global scale like this is a massive undertaking, and there are going to be many challenges. But the world has experience with similar types of vaccine that need to be shipped at different temperatures. We work with partner agencies that help us fly these vaccines around in the right types of temperature. We vaccinated people in the Democratic Republic of Congo with a vaccine that needed 2 doses with minus 80 degrees. We can do this. We can do this. We just need to work it out on how we get those logistics underway. And that's well planned. I mean, this has been planned since the beginning, because we knew the vaccines were being developed. And normally you sort of wait, you wait until you have a phase 2, and then you have a phase 3, and then you start production. All of that is happening at the same time, because we have no time.
That's a little scary to me, that it hasn't gone through all the clinical trials before it's being administered. Does that give,
No, don't get me wrong. They've gone through the clinical trials before they're being administered. What I'm saying is that the production capacity is being beefed up before we even have the results, so that when it's approved, you just kickstart the production. There's no vaccine, that you don't do that until you have the results and you have the data. And so that process isn't different. But normally what you do is you wait, and then you say, okay, now we need to beef up production. Now we need to look at the plants that are built. That's happening.
Process, the distribution strategy was being figured out at the same time. Because I remember one scientist who said, well, you can do it at the same time. So he didn't mean cutting corners on the stage of the clinical trial in any way, shape, or form.
No, there is, and let me be perfectly clear, there is no cutting corners on safety. There's no cutting corners on efficacy. We're doing this at a rapid pace, and we're accelerating the development of this, but vaccines need to go through the proper clinical trials with seeing the data, and there are independent groups that look at the data through the emergency process for it at a sped up process of how they are evaluated and given the use, but no compromise on safety.
Well, let me just ask you that question again. When you think about 2021, Maria, when do you think things will start to normalize? If you really, had to be honest with yourself and with us.
Well, I think in some countries right now, things have normalized, and if you look at Australia and you look at New Zealand, you look at many countries across the Mekong Delta, and they're normalizing. I think in
small population. I mean, places like New Zealand has a pretty small population per square foot, or whatever you want to call it. But let's focus specifically on the U.S., since most the folks from the U.S. What do you think?
I think it's going to take some time. I think you are many months away from getting back to what is normal, but it depends on how everybody pitches in and is able to pitch in. There are ways in which you can keep yourself and your family safe, and it really is about limiting your interaction with others outside of your immediate family. I cannot emphasize that enough. I say the same thing to my family. And if we have to put in the work, but you also need, to make sure that the approach that is there in any country that is an intense transmission, you have strategic testing, you have quick turnaround time for those results, and that those tests link to public health action. So we recommend globally that testing be strategic and that testing links to public health action, because That's what's needed. You need to know who needs to be isolated, who needs to be cared for, how contact tracing, and who needs to be in quarantine. And then we have to do the quarantine.
I know you have to run, and so do I, but real quickly, do you think that the Biden administration is going to have a better relationship with the WHO, with the World Health Organization, than the Trump? And I know that President-elect Biden has already said he plans to reverse President Trump's decision to withdraw from the WHO on day one of his administration. So are you feeling optimistic about better coordination with the US and the WHO?
There's many things that make me hopeful. And we will continue to work with the US and the new administration, and we're looking forward to that. But on a scientific level, scientist to scientist, that didn't change over the course of this pandemic. We continue to work with amazing scientists at NIH and US CDC, academic institutions all over the US. So that has not faltered, that hasn't changed, that has strengthened even. So we look forward to working with the new administration.
All right. Well, Maria, so good to see you again. If I don't talk to you, happy holidays. I
Happy
hope
holidays.
you have a little bit of R&R, because I know you've been working around the clock for the better part of the year, and appreciate everything you've done, and maybe we can catch up again in the new year.
That would be wonderful. So have a wonderful holiday. Stay safe. I hope all your listeners stay safe. Do everything you can. And see you in 2021.
Yeah, I can't wait. Enough of this year. Anyway,
Enough of this year. I agree.
If you guys like what you see, subscribe right here.